So I'm out here walking in the woods and listening. You can hear the birds, the cars going by, taking in the smells, looking all over. Just got done with the run, got my Instagram back, got the meta back, and it's like the thrill is gone. There's no going back. I will, just because of the business, and maybe there'll be a way to come at it from a completely different approach, which is obviously what was needed. And like, why am I talking about this so much? Well, it's just something going on right in front of me in my life that I can talk about without it being about somebody else or what's showing up in my now, along with a million other things, especially as a special needs mom. Whatever you want to say, there's no labels, don't take the label. Well, I'm going to just take that label for now and chit-chat with y'all, because there is no getting out of that fact. I chose it and they chose it, and some of them know, some of them don't. But I think what's hit me hardest lately is the fact that when a kid is diagnosed prenatally with a disease condition, the tentacles, so to speak, of the medical system are very present in the pregnancy and immediately in the birth. And it's like the tentacles of dependence start so early. There's never a chance really to pursue a holistic path unless you are vigilant from the beginning and understand how to do that. And I did not. And so I followed the rules, and I thought that that was the way to go. And when you wake up to it, it can be a little tricksy. And I'm glad to see it now, and like, not everything's bad. I mean, we need the doctors. We've developed this way of doing things that really is detrimental overall, I believe. And that's why I keep talking about it, because what are we doing? What do we want? Do we want to placate, palliate? Never really, we can say we're looking for a cure, but there's many things that can be done in the present, in the now, in the physicality, to stop the onslaught of these rare diseases, the, what would I say, amplification, exacerbation of them, because I don't believe it's just one thing, but there are certain things that everybody receives, and there's been a complete blow up of that schedule, the medical interventions that are necessary, that I'm not mentioning by name because I kind of like to keep one social media channel, has just blown up. And I've talked about it before, from like 7 when I was a kid up to 70 some now for the kids, I think, I think it's age 5. I could be wrong on that, but if you go and look it up, you can see it. It's pretty crazy. I started noticing it when my son, who was born in 91, was going in for his, well, baby visits and just the emphasis on the shots. And then with my second, my daughter, yeah, even more, like chicken pox. I was like, wow. And I kind of bought it. I bought the whole thing, that they didn't have to suffer with these childhood illnesses. Well, I don't remember suffering with chicken pox. I had it and I got over it and didn't need no vaccine. Now, I'm not saying that's going to happen to everybody, and we've chronically depleted an entire segments with these rare diseases, these systems. These individuals that have them are depleted and they're dependent, and they can't endure a rare disease, or a childhood disease like I could, because their systems have been plugged in for so long and they're on a bunch of medications, and it's not something that can happen overnight. But I do know that we definitely need to think about these medical interventions and finding other ways to treat. And there are other ways. That's one other thing I'm learning. I'm not saying stop giving them to the most vulnerable. This can be a progression, but where are we going? We're making this condition, like the one that my kids have, so much more complicated in so many ways. And it's, it's just prime play for our system, because we live in a organ-based medical system, as opposed to a more holistic whole body. And that's just the way it is. There's experts in these organs, and of course they understand how their organs work in the body, but it gets foggy after that, how it all interacts. So when you have a condition that causes benign tumors to grow in all the vital organs, you're seeing like a shit ton of specialists. And then there's a lot of medications, and then the mental health professionals come in because of the obviously traumas that these souls are going to experience and their families. And of course we all signed up for it on some level, and it's all in our charts and whatnot, but the reality of it is, it's what are we doing? Are we going to just keep making it worse and making people more and more dependent till they're just like hardly moving at all, like that Wall-E movie? Anyways, those are my thoughts, and I don't have a plan. I don't have, the idea I had is to really examine our Haxine Aronaruski schedule. And there's other toxins as well in our diet and in the environment, and that I think people are, that's safer, but it's hard to quantify or to kind of develop a parameter that affects everybody the same way. And I'm not saying the Haxines do that, but they're pretty standardized, is what I'm saying, which is another ludicrous thing. But yeah, don't look away from it. There's just things that are coming into our awareness now that we just want to stay open for, me included. It's hard to look at it all sometimes. I took a deep dive from being more of a liberal type into the truther movement, and kind of bounced back to the middle now. I don't know, some kind of middle. Really crazy times in our country, and I think we're all doing the best we can on some level with our charts and our pre-incarnation plans and our toxins and our medical system, and learning to open our hearts and feel what we're being shown. So I'm gonna walk on out of the woods here. It's so beautiful. And I'm kind of tired of my showing my face. Thought I'd try something different for once.